Here we have this abnormal CT. He's nervous. We're a month out. Is this treatment working? Let's get a CT scan now. It will show us what direction we're moving in. Welcome back to Montgomery Heart Wellness Clinical Rounds. And last time we talked to you about a rather challenging patient, Mr. MT. He presented to us with malignant melanoma, and the patient was very nervous about the recommended immunotherapy treatment for his cancer. And at that time, he had had an initial biopsy and a surgical resection of the primary tumor with some evidence of lymph nodes having cancer cells. A few months after that, they found metastases to the lung. And up to that point, he had elected not to take the immunotherapy because he was very concerned about the side effects. Today, we're going to discuss our plan of care, not to treat the cancer, but to enhance the patient's body's ability to fight the cancer. Let's take us back to the blood test that we had drawn on his initial lab visit.
Yeah, so a lot of things were very normal. His inflammatory markers, like the high sensitivity C-reactive protein, was less than 1, probably to him working on being plant-based already, perhaps. Myeloperoxidase was very low. His white blood cell count was at a good level in the normal range, if you will, even though that's different for every person. You know, a lot of times in systemic malignancies, these inflammatory markers will be very high. So that was normal, but a little surprising, somewhat. I mean, he felt really well when he first came here. What was abnormal was that his LDL was high at 137. The small dense LDL particles were also high. That was also surprising somewhat because he had been working on doing mostly plant-based. That's kind of this main summary. He had good liver function, good kidney function, markers related to any enlargement, distress of the heart muscle were very normal.
You know, that's interesting because you do mention some things that were normal. And I want to explain to the audience, you know, why we talk about these things. You know, we get blood tests for the purpose of understanding what's happening with the body. And so some markers we get that we look for widespread. So let's say, for instance, somebody comes in with a fever and we think they have an infection, or maybe they have an abscess, which is a pus collection. So we know there's evidence of an infection in a location. We'll draw blood to determine whether there's evidence of widespread of that infection. So similarly with cancer, if there's evidence of widespread of the cancer, sometimes you get clues of that based on certain tests, like a white blood count being elevated or inflammatory markers being elevated could be signs that cancer is widespread. And these were not elevated. So although we can't say with absolute certainty that cancer is not widespread, but there was not overt evidence that the cancer was widespread. Also, the liver function and kidney function were normal. If there's spread to the liver, oftentimes the liver enzymes will be elevated. And if there's some stress on the kidney function will be abnormal. But we didn't see these things. Now, you did mention something I think is very important. The patient had already started making lifestyle changes. And as we mentioned in the last discussion, you know, there are 3 things we recommend starting off right away: optimal nutrition and other lifestyle modalities, exercise, proper sleep, proper hydration, and of course, reducing as many over-the-counter medication and prescription medications you can are 3 things we like to start off with anybody who's diagnosed with cancer, because it's really important. So he had already started, at least the nutritional part. He wasn't on any prescription medication. So we don't know if the liver enzymes were elevated at one point at the spread and then it got better once he started instituting these things. But it was very good to know that not only he felt good, but these blood tests were good. The other thing I want to mention that was interesting that you mentioned was the cholesterol is elevated. Now, you know, as a cardiovascular practice, we look at cholesterol a lot, and we think of elevated cholesterol risk of heart disease. But there's a different way that we think about cholesterol. A different way I like to think about cholesterol is that an elevated cholesterol represents some amount of metabolic imbalance. Also, it can represent some other process or abnormality going on in the body, whether it's neurological, inflammatory. In other words, the body will make cholesterol in response to underlying damage or inflammation. That's why we see elevated cholesterol going up in heart disease, because you have blood vessel damage and cholesterol goes to those areas as part of the repair mechanism. Inflammatory cells, engulf them and take them to that site. So we see cholesterol plaque build up, and what's happening is they're trying to repair that ongoing vascular damage. But then what happens, it starts to develop stenosis and other problems. Now, but that process can occur in other places for other reasons. So it's interesting that here's a man with metastatic melanoma and the cholesterol's elevated. Can't say there's a cause and effect. However, I remember reading in the China study, Dr. Campbell and his group showed an association with elevated cholesterol and cancer as a correlation, a decrease in cholesterol and decrease in cancer. So there was at least a relationship that's been shown scientifically in the past with elevated cholesterol and cancer. So it's interesting that that was the one finding we saw.
How are the lymph nodes feeling? I know in the past one had been kind of painful.
One end of my arm is about the same.
Okay.
It doesn't feel like it's gotten bigger, but it's there.
Okay.
So I know that. And then the one down here is probably about the same. So I don't think they've got any bigger.
Okay.
So I'm waiting for them to hopefully go down.
Right. And then tell us about like the foods you've been eating.
Pretty much raw.
Plant.
Every once in a while I might have a microwave vegan burger, but I'm very careful at what I eat.
How's your energy overall?
Well, right now it's because I worked all night. It's not tired, but mostly it's pretty good. I haven't noticed any fatigue after doing this.
Okay, yeah, sometimes people can feel
So,
more fatigue
no, I
right
haven't.
away. What have you heard, if any, updates with the oncology team?
I haven't actually got a hold of them, but I went and did a CT scan on my own.
Okay.
And he wrote me a prescription for that. And that one, I had previously had some sub-5 nodules in both of my lungs.
Yeah.
And then that report said they couldn't confirm or identify them, so they could very well have resolved themselves.
Right, I remember that. That was good.
So that's good.
And that's great, because that was scary.
That was the one that
first,
I was really worried about, because
Right.
they were worried that was melanoma and it was going to keep growing.
Yeah, I mean, these therapies like the ozone, it helps modulate your immune system to do a better job on its own of fighting off diseases, fighting off illnesses. So the oncology team, I mean, what is their next step? You've still decided not to do
I'm holding off on immunotherapy because I'm just really afraid of what it can do to your body. Mm-hmm. And that's why I'm doing this.
Yeah. Once we kind of figure out more of your plan for the IV poly-MBA, we'll let you know and get that one scheduled as well.
Okay.
We'll keep working hard.
Yep. I appreciate all you're doing.
So he went through the treatment. He had received 3 high-dose ozone treatments so far, and
3 ozone, 2 or 3 of the vitamin C, Myers vitamin infusions, all the oral supplements like vitamin C, curcumin, poly-MBA, doing the raw diet. So he did all of that, and then he came back and was still obviously thinking about the lung mets.
yeah, the lung mets were a problem because, again, he had initially refused the immunotherapy before there was any evidence of spread. Then he went back to the oncologist because the nodes are getting bigger, etc. Then he, noticed a new lymph node, and then there was evidence of spread. Then the pressure was on. You've got to do this now. Hurry up. This can get out of hand. And so he was concerned about this. We are now, a month and a half after that other CT scan. He's not short of breath. His oxygen saturations are fine. So he has these metastases to the lung. Is it bad enough to cut off his oxygen, decrease his respiratory performance? We don't see evidence of that clinically. but here we have this abnormal CT. He's nervous. We're a month out. Is this treatment working? What we did, we decided to make the decision to repeat the CT scan. Now, this is roughly only 1 month into the treatment. We really are at a critical time now where this patient has metastasis to the lung. So the decision was made, let's get a CT scan now. It would show us what direction we're moving in. If it's the same or better, we can continue to do what we're doing aggressively. If it's worse, then he can at least rethink the immunotherapy in addition to what we're doing. So now we have Mr. MT back at the office. We ordered the other CT scan, and the plan here is to see what the findings are on the third CT scan, but we're comparing the third one to the second one. We want to see, what the findings are, if things are getting worse or things are getting better. Let's start from the first CT scan to see what the finding was, and then how it got worse from the first to the second one, and then we want to figure out where we are now.
So the first CT scan didn't show any lung or bone metastasis. It had a borderline inflammatory lymph node in the hilum near the lungs, but they didn't think that was very significant. Just follow that over time. No significant adenopathy or masses.
And so that first CT scan, they made the decision that, at least their impression was that they saw no evidence of spread. So they were going to recommend the low-dose immunotherapy to prevent spread.
Right.
And then he declined it.
Yeah, that was about 3.5 months. This CT scan did show a new left axillary lymph node, and it also showed 5 new suspicious lung nodules. So that was very alarming to the patient.
So after that second CT scan, of course, he came to see us, and he was very concerned. We started enhancing his nutritional therapy, added some metabolic enhancers. And again, we started the approach of improving the body's ability to heal itself and improve itself. Now, I really want to, again, reemphasize that, because we frequently emphasize to patients that the foundation of your healthcare is going to be optimal nutrition, proper sleep, hydration. And of course, in this case, we want to minimize medications, that are having further stress on the liver and the kidney. At this time, the patient was in limbo. He had not decided whether he's going to go with the immunotherapy. He was concerned about the side effects. I wasn't so worried about him making a decision whether he was going to do it or not. I was really focused on improving his body's ability, A, to fight the cancer, and B, if he decides on immunotherapy, to better tolerate the therapy. We've seen lots of our patients who are on nutritional enhancement, metabolic enhancement, they tolerate chemotherapy much better than in other situations. They had, lots of success, rapid remission. This is an enhancement regardless of whatever approach you decide to take. So I just want to emphasize that, because I think that's a very important point.
The third CT scan showed some increase in size of the left axillary lymph node, but there were no pulmonary nodules. So the interpreting physician wrote, "I see no discrete pulmonary nodules on the current examination. The sub 5 millimeter pulmonary nodules described in each lung based on the patient's prior study cannot be identified or confirmed and may have resolved."
The interesting finding here, in the summary, it says no metastasis. So he goes from the first CT scan, no metastasis, then he has metastases, then he starts enhancing his lifestyle intervention, adding metabolic enhancers, and then the metastases that were there that were very concerning are now gone. Now, there's another critical finding here, is that the lymph node that was there is larger. So what do we make of a larger lymph node? And I want to remind our audience that the lymph nodes are the houses of our immune system. So let's think, if your country is going to war and you have your military posts, you're building more warships, you're training more soldiers, more military men, you're building more aircraft. That's an indirect sign of something bad happening in the war. But the fact that you're enhancing your ability to fight the war in and of itself is a good thing. And in this situation, that increase in the lymph node size could be just simply his immune system revving up to fight the cancer itself. I'm not saying that it is or it isn't, but that's the other way to interpret that. But the definite positive is that the metastasis that was there is no longer there. So that's a definite sign that this cancer is receding to some extent.
And that was more of the concern for the patient, was the lungs and the lymph node anyway, which I feel we might all feel that way if we were in his shoes.
At this point in time, our course will be to continue with the aggressive lifestyle intervention, continue with the intravenous antioxidants, as well as the oral antioxidants, the metabolic enhancers, to continue to enhance his body's ability to fight the cancer. I've encouraged him to exercise outdoors more. The patient, by the way, continues to work full time. He's very active. He's not, lost any time off work, etc. And he's not been sick. He's feeling great. Most of the time his mood is up. Sometimes emotionally he gets a little bit distraught. His wife was telling me one day that people, don't believe he has cancer. So, well, he looks great. Does he have cancer? I thought he had cancer.
Yeah.
And so, here's somebody who's at least have early indication that he's conquering cancer. So I think the plan of care for us to continue to do what we're doing, we'll follow up with him. He's, of course, following up with his oncologist, and more imaging studies will be done in the future. So we'll keep you posted on the progress. Stay tuned. Thanks for joining us here at Montgomery Heart Wellness Clinical Rounds. As always, if you have any questions about anything we've said, sometimes there are medical terms that we mention that, although we try to define everything that we mention, some things may be a little bit complex. Feel free to leave a comment in the chat, and we will try to get our team to go in and answer as many of these questions and respond to as many of these questions and comments as we can. So until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.